Hello everyone, my name is David Marshall. I'm the Deputy Medical Director for Training at JRCPTB, the Federation of the Three Royal Colleges. This video is an introduction to the ARC-P process and is aimed at giving trainees like yourselves and also trainers advice in preparing for the ARC-P season ahead. There will be a series of videos produced and these will give examples of meetings between the educational supervisor and the trainee that highlight the ways that capabilities in practice, or CiPs as we'll refer to them, can be linked using evidence recorded on your e-portfolios and from various workplace-based assessments and from other sources of evidence that I'll example as we go through this short video. The new curricula have moved us away from the absolute numbers workplace-based assessments, which was effectively a tick box approach to training and was really not well liked by trainers or trainees alike. Similarly, we've now moved away from a time-based curriculum and we're now in an era with the new curricula of a more holistic approach to training. So it's expected that this will be more popular with trainees and trainers, and it's more reflective of real day. So in terms of the CiPs, there are three main groupings of these capabilities in practice that are all mapped against the General Medical Council Generic Professional Capabilities Framework, or the GPCs. Today's video is really going to concentrate on the generic CiPs. So in terms of the generic CiPs, there are 6 that are currently being used. The first CiP is the ability to successfully function within an NHS organisation and management system. The second is the ability to deal with the ethical and the legal issues related to your clinical practice. CiP 3 regards the communication and effective communication to shared decision making, thinking about situational awareness, about professional behaviour and your professional judgment. CiP 4 concentrates on really patient safety and about delivering effective quality improvement in patient care. CiP 5 reviews your knowledge and abilities in terms of research and managing data, and CiP 6 with regards to your ability to be a clinical teacher and a clinical supervisor. These CiPs are not reviewed in terms of entrustment levels as the clinical CiPs are. You're really determined as being either above expectation, at expectation, or below expectation. So really 3 assessment levels for the generic CiPs. Please remember that you are expected to take full responsibility for keeping your e-portfolios up to date. The data that is reviewed at your ARC-P by the team overseeing your training and making recommendations on you is completely inherent on you having a good up-to-date e-portfolio. It's impossible to make entrustment decisions if your e-portfolio is not up to date. If you have any issues with your e-portfolio, or indeed with an educational supervisor or a clinical supervisor, I would strongly advise you to contact your local deanery or HEE local office or your postgraduate centre administrator as your first point of call if you need any amendments to your account. Now, with regards to CiPs, they describe the professional tasks or the work within the scope of internal medicine. And CiPs are based on these entrustable professional activities that I've mentioned. The key aspect of the validity of the assessment is that it's a defensible way of forming a global judgment about your professional performance. Ultimately, we all have to be safe, and patient safety is of the utmost priority. And the CiPs, in the context of general professional capabilities, are all set up in that way. It's all about patient safety. Each CiP has a set of descriptors, as I've mentioned, and the descriptors are there to help trainers and trainees recognise the knowledge, the skills, the attitudes that determine you to be a competent and good internal medicine doctor. A lot of these descriptors refer to patient-centred care and shared decision-making. And that's really there to emphasise the importance of patients being at the centre of decisions about their own treatment, about their own care, by exploring care and treatment options, the risks, the benefits, and discussing other choices that may be available. So in summary, please remember your e-portfolio is a living document. It's not something which is only done in the lead up to your ARC-P. You should be into your e-portfolio on a daily or at least a weekly basis, informing it, updating it, linking it. And overlinkage is not necessary here. The new curriculum is not about linking everything. It's about quality of evidence. So don't leave it to the end of a placement. Certainly don't leave it to the end of your training year to add evidence. That's really not a good thing to do. Meet regularly with your clinical supervisor and your educational supervisor to have an active review of your progress towards the CiPs. Record everything that you think provides evidence for an educational supervisor to make an informed judgment about your level of entrustment. Don't be preoccupied about numbers. The previous training cohort were concerned that they had to have a certain number of ACATs and a certain number of mini KEXs and so on. We really now are looking at a small indicative number that are really needed to show evidence, but it's about the quality of the evidence rather than the quantity. If you have any problems with your portfolio, as I mentioned, speak to your local office or your deanery, or indeed speak directly to your training programme director, your TPD. But finally, enjoy your training. Medicine is a fantastic career, and you're very privileged to be working in such a fantastic profession, despite what the press say and what the naysayers think. All the best in preparing your portfolio. Thank you very much.